We're going to convene the county board meeting for June 16th. If you'd rise for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item 2 would be amendments to the agenda. I don't believe we have any amendments to the agenda. Item 3, we need a motion to approve the minutes of the June 2nd county board meeting. Do we have a motion?
So moved.
We have a motion. Do we have a second? Motion and a second. Discussion. All those in favor say aye.
Aye.
Opposed, motion carries. Recognition of interested citizens is next, and this is limited to items that are not on the agenda, and it's 5 minutes per person per subject, and anybody wanting to speak should come to the microphone. Anybody wanting to speak? Okay, we're seeing none. We'll move on to the consent agenda. These items generally pass as one motion. They can be, anything can be pulled for a separate discussion. I'll read the consent agenda. 5.1 is adopt resolution number 2026-91, authorizing final payment to McNamara Contracting, Inc. for the 2025 Pavement Preservation Program Bid Package B. 5.2 is adopt resolution 2026-117, authorizing enter an agreement for a targeted cost share project for steam bank stabilization on Raven Stream. 5.3 is adopt resolution number 2026-126, authorizing county project submittals and supporting city applications to the Transportation Advisory Board for the 2026 regional solicitation and the Highway Safety Improvement Program solicitation process. 5.4, adopt resolution number 2026-130, authorizing entering Amendment 1 to the Minnesota Department of Human Services Mobile Crisis Response Contract. 5.5, adopt resolution number 2026-132, approving a one-day temporary on-sale liquor license for the Hometown Bats Foundation in Belle Plaine Township. 5.6, adopt resolution number 2026-133, approving an amendment to the solid waste license of Prior Lake Aggregates in the city of Prior Lake. 5.7, adopt resolution number 2026-137, approving a conditional use permit for a private indoor horse riding arena. Holly and Eric Zimmerman, applicants and property owners. 5.8, adopt resolution number 2026-138, approving an interim use permit for a detached accessory dwelling unit. Christine Isaac and James Toomey, applicants and property owners. 5.9, approve record of disbursements and approved claims. 5.10, approve payroll processing of personnel actions. That's our consent agenda. Do we have a motion to approve the consent agenda?
So moved.
We have a motion. Do we have a second?
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Aye. Motion carries. Item 6.1 is to receive information on Scott County Delivers. The topic is promoting attendance and school success, PASS, and promoting attendance through Hope, PATH. Okay, Katie, you're taking this away, starting off?
Yes, thank you, Mr.
Thank
Chair
you.
and Commissioners. Just let some people get to the table real quick. Well, good morning. Thank you again for another opportunity to have another Scott Delivers before you. As you've heard, this is a more specific Scott Delivers. Sometimes these topics can be really broad, and today we're discussing two specific programs. I'd like to start first with people introducing themselves and saying where they work. I'll start. Katie Malika, Quality Improvement.
Danny Lenz, Office of Management and Budget.
Kate Sudlogic, Environmental Services.
Adam Chesson, Physical Development.
Nikki Hulberg, Child and Family Services.
Amy Hohenstein, Belle Plaine School District.
Paula Frisk, St. David's.
Emma Wagaspak, the Catalasso Group.
Lisa Welter with the Catalasso Group.
Samantha Goldman, Children's Services.
I'd just like to start with thanking everybody for working on the packet. I know this was a lot of work, and the focus was really to provide some financial information in addition to some outcome information as we trend towards a time where funding sources can change on this. I think we have a kind of foundational question coming from Kate, so I'll have her start off, and of course, commissioners, please jump in at any time with questions. So, start, Kate.
Going through the packet, I was hoping we could, it goes to chart 10 and to just the beginning of the narrative. Could you go over and describe what is the truancy process? For example, what constitutes truancy? When does the county board, or when does the county get involved with a truancy?
I can take this question. Truancy is defined under the guidelines when a child 13 or over misses school, 12 or over, misses school for a consecutive certain amount of days. The school district is required to make a report regarding their absences. The PATH program is, there's an option for prevention where if the child hasn't met that threshold yet, there is a prevention option to divert that absence from getting to the point of a truancy referral. If that prevention program does not work, the diversion program is, then the report is sent to the county, and that, where it meets the threshold, is considered truancy.
Okay, thank you.
Maybe to hear a little bit about the referral process from the schools, so Nikki and Samantha can talk about this as well as Amy. You know, there's on page 18, there's some statistics on where the referrals are coming from in terms of different school districts within the county. And, you know, obviously based on comparing that to population size, there's maybe some school districts that are doing more referrals per capita than others. Can you talk a little bit about why that is, how, you know, what's the process for making school districts aware of this and making this resource available to those school districts? And how can we kind of drive school engagement in this process?
So I don't know if maybe that's, Paula, if that's maybe a more appropriate question for your agency and maybe also the Catalasso group. So I will just say from the county perspective, when these programs were implemented, really part of that was how our agencies that we've contracted with, St. David's and the Catalasso group, going to reach out to schools to talk to them about what resources are available.
So we are reaching out regularly to all the schools, and we're looking at the results year after year to see the same thing you're looking at, like who is referring, who isn't, and then we're focusing more on those districts that aren't to find out what's happening. Sometimes we're hearing things like things are going really well. We don't have the same ed neglect or truancy issues that we have had in the past. Other things can be structural or systemic issues around them feeling like they can't refer directly to us for prevention because they don't have releases of information from families, so they need to get to that reportable level. So we're trying to work through those systemic things with them. There was recently an attendance group meeting that we attended last year where they're trying to build some different rules around attendance so that those referrals can more easily come to us as providers. So again, it's the one-on-one meetings with the deans, the principals, and the social workers to have those conversations around our programming and how they can make those referrals to us.
And I will just add, I do all the referrals for Belle Plaine, and I know if we refer quicker in the process, it doesn't go to the diversion or the truancy level. So there's another level of intervention, which is super helpful. At the point where we refer as a school, we have exhausted all of our resources. We've done meetings and parent meetings, check-ins, changed schedules, had family meetings, different reward systems for the students. We've done everything, and it's still an issue. So then having another, resource is super helpful, an outside perspective and new eyes and new ideas, and yeah.
Maybe just to follow up on that quickly, that for St. David's, for example, is that earliest level of, getting involved in this? What does that look like in terms of what are you actually, doing with either the student or the family? What does that look like?
We're taking those referrals when there's 3 unexcused absences, so trying to hit that gap between there, as Amy said. And we're meeting with the families, making sure they understand the attendance rules in their school district, helping them share with us what other things are happening in their family that's making it difficult for them to get their child to school. And as we all know, it's not typically just an attendance problem or they don't want to take their child to school. It's more than that. It could be some health issues. It could be transportation issues. It could be many different challenges, so we're trying to understand what those are and then where we can come in to support those changes for that family or additional resources to support them to mitigate those barriers that are getting in the way of attendance.
Great.
So speaking of that, if we could turn to page 22 on the past referrals, increasing protective factors. I think that's kind of going to what you were talking about. Can you explain a little bit more of the 5 different protective factors?
Sure. So there's parental resilience, which is a parent's ability to address stress or acknowledge that there is stress and do things to mitigate that stress. I'm trying to think, social connections, the other one, and that I think is that's the concrete resources piece, but also do I have a community around my family that can help support me? And that is one that we find is one of the lower ones that we see, is families are very, very isolated and often don't have social connections. So we're trying to figure out what are other areas in the community that we can connect them to. The FRC has been a huge gain and support there. The concrete support, sorry, I jumped ahead. Concrete support is the other one, so that's your resources. Do they have financial struggles? Do they have housing struggles, transportation, food, all of those things? Social emotional competence of children, that's really helping them understand what can you expect from a 7-year-old. You can't expect them to get themselves up in the morning and out the door. And you might not be able to expect them to get themselves to bed. They might need some support around that. So we do a lot of helping families think about schedules and thinking about what does your child need to get out the door and what do you need to help them get out the door. Sorry, I don't have them in my head. The last one's the knowledge of parenting. Is that the right one? Very similar there. That just focuses more on parenting skills. So helping them shape how they want to parent their child.
While we're on this graph, I was curious how this data is gathered. Is this self-reported? Is it St. David's or somebody doing an assessment, and is it kind of a quantifiable assessment, or is it a little more qualitative, or how does this data get generated?
Yes, we do an assessment at the beginning of our work with families called the PAP, or the Promoting Assessment of Protective Factors. And we look at the parent rates themselves on these areas. It helps us identify where can we support a family, but it also helps us have conversations with parents around what feels hard here and what can we improve, and that's where we focus our goals then with families. And then we're doing that assessment again when possible at the end of services. There are times when we're only seeing the family a couple of times, and so to do that assessment again doesn't make sense. So we are thinking through and having conversations. That's when we take this information more from a case file documentation.
I also had a question on this one. So as we're looking at this data of the improved protective factors, can we correlate that to seeing improved attendance as well among our population? Where we say, hey, this family really engaged and we saw improvement, and their kids also had improved attendance as well. Are we tracking that comparison?
Can you say that one more time? I wasn't tracking the
So-
full question.
We have a family going through this referral, and so we're monitoring, seeing that, yep, there are improved protective factors from the family. Are we also correlating that with the children in that family having improved attendance as well? So I'm sure there's data that supports this, but are we seeing that play out in our school system as well?
Yes, there definitely is a correlation between these factors improving and the child returning to school, maintaining better attendance.
And I would just add at the older levels, say 12 and over, it would be if they're not coming back to mainstream school, they're figuring out what works for them, whether it's a day treatment or an alternative facility or getting that support that they need to move in the right direction.
It's also a correlation the other way, right? If we're not seeing those factors improve, we are recognizing that that is getting in the way of a child having some consistent attendance.
If I may take us back a little bit, so on page 10, we have a chart that talks about percentage of students with improved attendance at time of truancy case closing. But this data is from prior, the PASS and PATH programs. I'm wondering if you could give me a little bit of history into what this chart tells us and how it connected with maybe the creation of these programs?
So I think if I can look, I think a couple of things contributed to the beginning of these programs. One, like, right, we talk about COVID and we saw an increase in missed school in regards to COVID. And so wanting to take a look at how we were providing services for families and for schools. I think in addition to that, when we talk about our truancy case closings or our truancy caseloads throughout those years, those caseloads had gotten pretty high, and so at that point, it was really hard to do like specific services for families, right? Like if you're holding a caseload of 60 cases, like, are you seeing people as frequently as you'd like to make sure that you're working on some of those attendance issues? So I think those were the pieces where we knew we had to take a look at, like, how do we further support schools and support kids and families in taking a look at services provided for them. So that was part of looking at like Catalasso and then also Treehouse in regards to truancy services to support schools and families.
I would also add that there, qualitatively, when you're talking to families, their response to a community partner within the realm of school attendance and their barriers and issues, the engagement is different. With the high caseload for truancy, you're seeing one contact, you're following up on attendance. You may not be able to do that qualitative work around how do we remove the barriers, how do we add in concrete supports, how do we understand the underlying issue because of the high caseload in that one individual. But moving them to the program or to a community partner takes away the stereotype of it's a county program and it's a county person, and if I don't respond to truancy, I could go to court, or there could be worse things that happen. It's more of a voluntary approach that gets better results.
Were you all seeing outcomes that you expected at that time?
At the time of this, but prior to PATH being introduced? Yes. Yeah. I think we were seeing that it was an in and out system. It was, you're in for truancy, we're working on, you have to go to school this year. How many times did you go to school? And then seeing those sometimes similar children or youth return the next year. While we still have that, it's less of that. And so I think the quality of the work is different.
And then for our providers here, maybe you can kind of illustrate for us what this program might mean to those families. What kind of stories are you hearing from them, from you guys being able to provide that service as opposed to it coming in a more serious case to the county?
Sure, I can start. I would say that we're hearing from parents where they've lost control or it's a power problem in the household, and we're talking teenagers, so the 12 to 17-year-olds, 18-year-olds, and we come in as conflict coaches and mediators to help straighten out what's going on in the emotional tensions here at home and how can we improve that? How can we help mom or dad take the reins in a better, more appropriate way while kid gets their voice, but they're also showing up back at school. So we're doing more negotiations, we're doing more conflict resolution in the work that we do, and I think parents have really appreciated that. Because how many of us, let's face it, how many of you took conflict resolution in high school or in college, right? We're just taking what we've known in our family history, and so I see that being just a major win for parents.
I would say that for us, we're a bridge for the families to the school. And I know we've heard feedback from both families and from schools how much they appreciate that kind of transfer of understanding the full context of what's happening for a family. A lot of times the family is challenged to communicate, and we support that communication around. It'd be really important for the school to know that you have some health issues that get in the way of you getting up consistently every morning with your child, and you need some additional help. And sometimes schools know that and sometimes they don't. We're also holding a lot of families who've had hard experiences themselves going to school or their own experience of what it was like to attend school. And so helping them communicate those and hold and really perspective take. Boy, that what sounds like it was hard for you. Let's think about what this is like for your child and how we can create a different experience. So we're hearing from families that they really appreciate somebody holding their story and helping them share it with schools, and the same from schools around. Boy, it's really nice to know that there's more to this story, and we'll do some different things here with this family.
So I apologize, I'm gonna jump between a couple different pages here, but on page 16 and 17, we've got the percent of students served that have a subsequent truancy report in the following school year, and then on 17, it's the percent of children who had an additional maltreatment report within 12 months. And I think, the intent there is to show kind of that change that we're making in their lives, whether that's the kind of the main issue of truancy or outside issues within the family, speaking to those maltreatment reports, that we're doing more than just solving school attendance, hopefully, right? We're having greater impact there. So I think that's obviously a very important thing. That's showing the outcomes here. How we get to those outcomes, I think, I'm bouncing all the way to page 2 in the packet, but there's this graphic that shows, what creates low school attendance. We've got student factors, family factors, school factors, community factors, and systemic factors. I think my question is, these programs in particular, do they best address, one or two of those factors, or which ones can we make the most impact to, and also which ones have the greatest impact on truancy, if that makes sense? Is there any of those in particular that we feel is driving the truancy issues, and how do these programs specifically address those factors? I know it's kind of a broad question, but.
I can just talk from the school point of view. I think, like you said, bridging that gap from the school to the family, I think is just a really great statement. Really understanding the whole child, the family dynamics, what's going on, where the issues lie, where are the roadblocks. And I think from an outside, not doing that, that work, just doing kind of the pre-work at the school level, I see really breaking it all down and addressing whatever the factors might be. So probably the whole graph, if there's legal issues, that's kind of being talked about and addressed, and separating that from the child and having parents deal with what they need to deal with and not put it on the kid. If it's mental health, or if it is health-related issues, homelessness, money, rent assistance, wherever it's a huge continuum, and I really think a lot of those things come out in these conversations and are addressed, or at least providing additional support so then things can get dealt with. And not that the school doesn't know that. Sometimes we do and sometimes we don't. And I think where it gets to be an issue of truancy or really poor attendance, we have issued detention. They're sitting in the office. They have failed a class. Sometimes there's a preconceived notion from the student of, well, they're never in my class. So there's maybe a negative feeling along with where they're at, and the school kind of is the bad guys at that point. And then we've got these additional supports that can kind of come in and have a fresh start, which is really helpful, because I think that, like we have said, we've exhausted a lot of our resources at that time. And so we may know some of the, the graphics of what's going on, but not all of them. So that's kind of.
And I think you'd made mention to page 16 and 17. I think Amy did a nice job of talking about some of those things that impact, page 16 in the truancy. But the 17, the additional maltreatment report, I think really we're taking a look at what is our culture of prevention in Scott County and how that impacts all of our child protection cases, which is the maltreatment piece. So our resources, the Family Resource Center, our school programs, it's really taking a look at how do we treat families across the board, families that don't enter our child protection system and the ones that do. What are we providing those families for services? I think it's also our practice framework in child protection, how we work with families impacts our lower maltreatment responses. And then it's also our school programs and their practice framework. Like Amy talked about in the work St. David's does with the protective factors. Protective factors are known to reduce child maltreatment. So all of those things combined impact our maltreatment reporting.
I have a question. In the beginning of the packet, it says there were mandated child welfare responses following 2020 statutory changes, or 2025 statutory changes. Could you go over what those changes were, those statutory changes were, and how those impacted your programs and what, with neglect and truancy?
Absolutely. Prior to 2025, anytime a report regarding educational neglect or unexcused absences was received, if it met the threshold for a child protection response, it was required that a child protection response be initiated. So it was required that a child maltreatment report be completed and an assessment be assigned. In 2025, this changed to allowing counties to either internally change that process, work collaboratively with a community agency, and offer a voluntary outreach prior to making a child protection report. So when a report regarding unexcused absences is received by the county, prior to assigning it to a child protection worker for an assessment, we have the ability now to change it and make it a voluntary outreach for because of that legislative change. So we would then send it to PASS or PATH based on their age. And that voluntary outreach is more effective in engaging families in the problem or what the attendance issues are, and then not having the family enter the child protection system under a formal assessment.
So curious, is that a scenario, is that what would happen, that scenario that would happen if they chose not to do PASS or PATH, that they would then go to child protection?
If a family is referred to PASS, PASS will attempt to engage and use outreach multiple times through different ways. If they're unsuccessful for whatever reason, they will refer it back to the county, and the county would then be responsible to complete a child protection assessment based on the family's either like refusal of the service or just lack of engagement, because we would still need to address the school attendance concern.
I will just add, in 2025, when the legislature changed this rule, like, it didn't really impact us at Scott County because we had been doing this work prior. I think one of like a handful of counties really took a look at like these attendance programs and did that child welfare, that community agency outreach, and that was really part of the change in legislature, because we saw that as a better outcome for kids. And so when this change happened in 2025, this is the way we'd been doing the work. And so it just kind of continued.
So they were catching up to you.
Right.
Okay, excellent.
A little, yeah.
Can we go to page 11? I have a number of questions on this, and it kind of pervades some of the data through it, so you might have to bear with me a minute. One, I just wanted to ask for a clarification, because you see it several times where it says no data on the top, and you might see data not available. I know there's a reason for that. I just wanted to give an opportunity to explain that until we go through every slide, saying, why does it say no data?
I think part of it, there's a couple of reasons. One, I think anytime like new programs are implemented and you're working with providers and like we collect data in a certain way at the county, and then it takes some time for some of our community agencies and us to work some of that out. That's a factor. I think another factor is some of these reports, and Lisa, maybe you can talk to, we get these reports pretty late in school, and so we might not be able to assess whether or not attendance has increased or decreased if we've gotten a referral in May, per se.
Exactly.
So along with this, if you look at, and I like that this juxtaposes the county with the truancy response versus a provider. 22, 23, data's okay, but then we jump to 24, 25, and you see under the treehouse program, there's 0 clients that worsened. Those that come into the county, you still see 13, and then very few are actually improving. Can you just talk a little bit about what that big jump was between 22 and 23 for the Treehouse program and then into 24, 25? Like, did we learn something? Like, what was the big, kind of big shift to where we really started to see significant improvement?
I think one of the reasons we're seeing in some of the county response too is we do see families have typically an increased participation with some of our non-county providers. I think that's one thing that impacts counties, I think, families, I'm sorry, feel more supported. They don't feel scared, they don't feel threatened. So they do sometimes work easier with our county provider, or our community providers. I think another reason is, like, as we implemented all of these programs, right, we kind of created a funnel. So schools have changed some of the way they work with families, right? And they've increased some of their contacts and what they're doing to help families. And so that's kind of the beginning of the funnel. And then we look at the families that are sent for the prevention referrals. So that's kind of lowers the number of families we're getting there, and it's an increase, and they might have more struggles at home or in school. And then it gets to our diversion programs, which is even lessening the funnel a little bit more about the families that are probably the most struggling. And then from there is that county response, which is really kind of the end of the game. And so those are our families that are struggling the most, whether that be with issues at home or mental health or chemical health, but they are our families that are struggling the most. And so we're going to see a more difficult time getting those kids back into school.
I had a similar question, so this will be very similar, just on page 14. So I think this data is specific to the Catalasso group. I noticed a similar thing where between the 23-24 data and then the 24-25 data, there was significant improvement there in terms of, just the success rates. So just wondering, is this, maybe a broader question would be, how does this program get evaluated and improved year over year, or all of these programs? How do they all kind of have that continuous improvement methodology to see that, this is how we do it today, but maybe we can do better next year, and kind of how we look at that?
Yeah, if you look at this slide, you can see that the number of referrals even decreased, and we were analyzing, what is that all about? And we noticed that our schools, the support staff, were now starting to pick up our strategies and implementing that in-house. And so we've taken that as like, what a win. Let's teach and equip our schools how to do this process, because they definitely have the better relationships. We're the neutrals. We can certainly come alongside those families, but if the schools can learn how to facilitate prevention, even better. So that is actually a great depiction of how schools have begun to mimic and model what we're doing. And so this summer and last summer, we're teaching and training schools how to become mediators. So they're selecting their staff, picking those that would be wonderful resources to the families to step in and have those two restorative conversations. Yeah.
And I will say, I went to it last summer, 40-hour training, and it was phenomenal. And I do a lot of what was taught. I mean, a lot of it, yeah. So.
And I would just add, for us at St. David's in the past program, we're having conversations regularly about continued quality improvement, but we also do formal surveys with all the schools and parents and take that feedback into consideration. Summer is also a big time for us to think, okay, what went really well this year? What was harder? We're looking at the data. What schools dropped in referrals? What is that about? How do we find out more? How do we target those? So really diving into the data as well to think about what we can do differently, or what do we need to do more of the same.
If we could look at page 16. So this is the percent of students served with a subsequent truancy report the following school year. And I just wanted to make sure I was understanding this right. So when we see the total clients who receive services, is that who received services in that year? And then the ones who saw a subsequent referral, are they seeing it the next year from what we're seeing? So if we're looking at 23-24, 56 clients received services. And then for the 24-25 school year, 6 of those students had a referral again the next year. Just wanted to make sure I understand.
Correct, yeah. So these are the students that kind of at the end of the funnel system, right? We receive services through our Scott County truancy program. So of those 81% didn't have a subsequent referral the following year.
And do we do anything to like eliminate students who moved out of district or graduated or anything from those numbers within there?
That I don't believe we can track. So we just track if we've received a report the following year, we have no way of reaching back out and finding out if that student is attending a different school or is moved or.
Gotcha.
Yeah, just to, I think you hit on this point earlier, but in the years since the PATH and PASS programs have been implemented, actually, the county is seeing a higher recurrence of people that they have to serve, and part of that is because if they make it through the PASS and PATH and they make it all the way to the county with all of these prevention things, those are really your worst situations that you're dealing with, the most complicated situations that you're dealing with, and so, it was kind of diluted previously with some people that you could more easily serve. Those people are getting caught now in the prevention side. Is that one way to look at this?
Yeah, I think one way to look at it is like we're actually doing less truancy in county, and I think also that gives us an opportunity to serve families better. When you're looking at, we've always had one truancy worker in Scott County, and so if you're getting 65 cases, like that's gonna look different in regards to the work you can do, rather than if you're having 30 families and the work that you can do with them. And so I think even though like those are families that are some of our, families going through the most hardships and having the most difficult time, we're able to do better work because we have less families to work with, so we're still seeing good outcomes.
Anything else, anyone, that you just want to say about the program in general, or, any slides that we haven't picked out that you want to talk about? Anybody?
I would just like to add that it's from the school point of view, it's wonderful to have outside resources. I know that we're here for the families, we're here for the students. We're all trying to do common work, get kids in school and just make sure that they're kind of, moving along and moving in the right direction. And so the partnership is phenomenal. Everyone gets busy and it's just nice to have fresh eyes and a team and bounce ideas off one another. And also just a good reminder, and I've heard this throughout the years, of no one has a magic wand. And so we're all just trying to put in a little bit of our own expertise and get to a good common ground for the students, the kids.
I have a question on page 18. This may be a hard one to answer for the group that's here, but the Prior Lake Savage School District had 8 referrals in 22-23, 9 in 23-24, and then jumped up to 28 for 24-25. Do we know what really drove that increase? Was it just more engagement? Was it education?
Yeah, that's passed, so that's a result of some of our looking at the data and then saying, boy, those numbers are low, I wonder if there's more there, and how can we connect more with those schools, help those social workers think about how they can get more prevention referrals to us sooner, those kind of things. So we did see an uptick in those referrals. I think over time, that is our goal. I know over time, that's our goal, is to continue to help schools think about families sooner, to get those prevention numbers. And year over year, we are seeing that happen. And even on those calls, our family support specialists are saying, any other families you want to think through that are coming on your radar that we want to think through right now, that might be a possible referral for our prevention programs. Just to have those regular conversations has been helping our referrals go up.
Yeah, I think in addition to that, like what we've learned is anytime you implement a new program, it's a little bit of a dance of who are you reaching out to in the schools? Are you doing a combination of superintendents, principals, school support staff, teachers? Because in so many schools, they do things differently. And so how are we making sure we're reaching all of the staff in those schools? And so with a new program, I think that has impacted some of our referrals. I think there's also the complication sometimes of schools then they find something that a community provider is doing and they think, well, we can do some of that. And so I think we've also seen some of that increase in schools, a lot like Amy talks about, right? Like, well, we can do some of that work with families. So then I think obviously like Belle Plaine will likely maybe make fewer referrals in the future because they're doing some of that work internally.
Nikki, excuse me, so Prior Lake and Shakopee are about the same size districts, right? When we take a look at that in some ways. Are you seeing any relationships between our mental health workers in the school and the truancy program, or referrals or things like that, and how they work together?
I would say not so much. I mean, I have connections in a lot of these schools. We focus more so on not necessarily attendance and truancy, but more so mental health. What programs are you doing? What are you doing to reach the kids? Which all goes together, yes, but not specifically attendance and truancy. In Belle Plaine, we've adopted some new protocols and rules and thresholds for days missed this past year, which we saw a great improvement. And so, and every school does it different, and the size. I mean, Belle Plaine's a good, solid size, a little bit more manageable, and then these bigger schools, and attendance is a beast. It can be a full-time job and more. So to stay on top of it and to be readily right there, the turnaround within one day is a lot. And so, that's a great point, though. I think it'd be a good idea to connect more so on attendance and truancy and what we're doing. And we constantly share ideas within Scott County. We have a Scott Family Net meeting every other month where we talk about, some of these issues. And, yeah, I think it comes down to who's available, who can do the work, the day-to-day work at each building.
I think that's also a good point for us to maybe look at tracking in the future, because I think we're not seeing necessarily the referrals from those mental health providers, but are we seeing families that are having, or students that are having attendance issue, and are we making referrals to that program to help support some of those needs for kids to get back into school?
I would say that's something we've looked at as one of our pieces that we want to do this next year, and it goes back to Nikki, your statement around we're learning who are the right people to connect to in the schools, and we've identified that is an area that we think could really support some prevention, thinking about the Connect programs. Who are the families that are on the wait list, and could we get in to support those families while they're waiting for those services? So how do we make those social workers and therapists familiar with our services as well? As they're going on those lists, could they also be put on our list so we can support them while they're waiting?
More just broad question across the data. So as I've looked through this, the numbers spiked and then have kind of gone back down, just in referrals in general. Is there any point where we go back and kind of zero base this and evaluate, okay, this is where we were before, this is where we are now, kind of after 23, 24, and look at, is this still the right program, right level that we're doing to say, there was a weird 22, 23 school years, are we back to more what we were in 2019, 2020? Do we need to look at this differently?
I think we continue to kind of evaluate like where we are, where schools at. I think we're coming into, complicated times with schools, as like resources get scarce. I think what we've learned in talking to schools over the last few years is we've also done some work in our mandated reporting, mandated supporting programs, and what we're hearing from schools is like they want to support families, but how do they have resources in order to do that? Like how do they also have support or a place like the Family Resource Center to send families, or some of these prevention programs, taking a look at their attendance and how they're doing some of those things. And I think some of those shifts are where schools are starting to do a little bit more, and then we run into some districts who might have staffing issues and they're doing a little bit less, and so we're getting more referrals. So I think all of that is things we continue to evaluate with schools and with our community providers.
Thank you. With respect to time, I'll turn it back to Mr. Chair and the commissioners for any further questions.
All right, we'll take, thank you for that presentation. We'll take questions or comments from the board. Go ahead.
Thank you, Mr. Chair. Thanks, everybody. Really excited to just hear about how this is all turning out. A couple of years ago, we invested and really thank the staff for being creative, for following it along and making it work. Just a couple things I heard that really resonated with me. I do hope that we, the Connect program, social workers and therapists are obviously county employees. Let's make sure we're connected. I'd like to see that data, and there should I hope that's kind of a next step if we continue about what is that connection with those waiting lists, with just outcomes for students who are involved in both sides of the program, one side, that type of thing. So that really resonated with me. So interesting about the referrals by district, and how a couple years ago that might have meant one thing, and now, like you said, Lisa, that could mean a whole nother thing, just that they're doing the work. I did find it interesting, though, when I look at Jordan with so few referrals over years, is that they're doing it differently, they have other services, they just, any feedback on that school district just doesn't seem to be participating as much?
This is the one I remember because we have paid attention to this, that we're hearing that they are not seeing as much numbers overall.
Good.
For ed neglect or
Okay.
truancy.
Good. Because at first when I looked at it, I'm like, oh, we're not seeing referrals there. Does that mean we're seeing more kids who end up in our ed neglect, caseload from those schools or not? That'd be interesting to know if there's a correlation, but just by what you said has happened over the last couple of years, it threw all my statistical analysis off about what I thought about those numbers. Maybe I missed it, but I didn't see things in the packet or hear about how this is impacting costs and staff time in the county attorney's office. Have we seen truancies that get to that level decrease? I don't know off the top of your head, Ron, if you have anything to say about that.
We've seen the referrals to my office decrease, because they've been doing a great job on the front end for diverting it and taking care of the situation, so, and that's the best model. We found out once, the court is really kind of ineffective, going in front of a judge, because, as been mentioned, it's not really an individual student issue, it's typically a broader issue with the family, and getting the whole family together and trying to figure it out. So just throwing the juvenile in front of a judge, historically, just doesn't do much. So the diversion model, getting in front of it before it gets to my office is the best way to go about it.
Great, thank you. I thought so, but wanted to clarify that. And then, I guess as far as the training that the Catalasso Group's doing with schools and to help empower them to do this work, what's the percentage of districts in the county that are taking advantage of it? Is it half? Is it all? Is it 2? Where are we at?
Yeah, so we have a 3-year plan to train everyone. We've made that recommendation. So we have, we've trained New Prague, Burnsville is getting trained this summer. I'm sorry, we've trained Belle Plaine. Jordan is getting trained, Shakopee Middle Schools are getting trained. So we're really just waiting on Shakopee High School and the Prior Lake School District to jump in and be trained. And we hope that they'll join us by next summer to do that.
Thank you. I think that's all of my questions. Thank you, Mr. Chair.
Yeah, other questions, comments? Go ahead.
Thank you. Yeah, I think, what are we diverting from Ron's office? He's busy enough on his own, and how does this? Exactly. Oh, good. Let me just scratch that off. Okay. Part of what we're trying to do is cut them off at the pass, right? So they're not going into these deep end services, and there's this big tapestry, that old analogy, you turn it around, it's just a bunch of knots kind of tying on the back. It's maybe not as glamorous in the back, but when you turn around, you hopefully look at this awesome tapestry or mosaic. And so it was really heartening to hear Amy talk about how things coming together. And the more we do this, it feels like there's more of an awareness. Now we're talking about this particular topic, but any given day it's other people in your seats with the idea of how do we collectively bring about better outcomes with hope and transformation, so that we're like severing these oftentimes generational traumas, generational sin, generational baggage, and so that we're changing the trajectory of lives. And so that's heartening to hear that, and it's hard to measure. It's hard to measure those things, but we certainly need to try. What works, because sometimes the control group is like, well, what if we did, in this case, just because you're the topic of the day, like, what if we did none of this? What would the end game look like in the overall scheme of things with the tapestry of things? And again, I'm not targeting or saying, I ask this of other people, just ask them, believe me. And just, we have to ask those questions, right? Is this working? How do we know? I think anecdotally, we hope, and again, not specific to this, but in the overall hope and transformation and better outcomes and lower cost of government. So it's just great, because I think a big part of it is the awareness of what everyone else is doing in the space, the entire space. And I think, you know, county as convener oftentimes can be that conduit for other folks to know what other folks are doing. Here we've got 3 different groups, 3 different jurisdictions, 3 different groups talking with us at the county, and I think we have a common goal of we want to see people do better. People have to want to do better, right? We just kind of creating that space that allows for that hope and transformation just to soak in. And if people don't want to do it, like, you can't really make them, right? And that's not the business we're in, although maybe across the street we are. But, you know, we really try to be about hope and transformation in everything we do, which is why you all are here. So love to hear that, because it just helps, because it's really hard to measure. What's the old expression? Not everything that measured, or not everything that is measured counts, and not everything that counts can be measured. So that's the hard spot that we find ourselves in this type of space. So glad we're moving forward, glad things are seemingly looking up. It's just, you know, what is that magic wand or the silver bullet, the secret sauce? I think our heart is in the right place trying to push these things forward, which is a good place to be. And yet we still have to ask those hard questions.
I do think the one thing we know, or we knew back then, and we continue to learn, is that kids do better when they're connected to school, and they're connected to people at school. And I think that, you know, as this speaks to the amount of truancy referrals we're not filing anymore, because we haven't seen good outcomes with court intervention. And we haven't always seen good outcomes with county intervention, because that really does sever the relationship between schools and families, right? Families feel mistrust because, you know, they were reported or they were taken to court. And so I think these are the programs that are really helping kids feel more connected to school.
Well, we are beings of community at every single level. So the more we can build into families and build into community, whatever that might look like, as opposed to isolation, even if it's, you know, across the street or whatever. Yeah, I mean, families first, community first, whatever we can do to do that we're built for that. So I appreciate that.
So I do want to thank Ron, because sometimes it's easy to say, no, I have more work from this, right? To Commissioner Beer's budget question, so that he's saying this is better for families and better for the whole program. I appreciate that and your support in that with our staff. That's a really positive thing. One of my questions, though, that came from Commissioner Brecky that spurred, are we tracking like the folks in public health and follow along? And if any of them end up in ed neglect in their elementary years or things like that, is it another touch point to see if that program is having some positive effects on things as well? Because, right, isn't that families that we think are kind of struggling or need some supports to get off on the right foot? I know I was out at several Jordan families once upon a time. And so I'm just wondering if there's a touch point there we could use our BIS for to take a look at some of that data as well, to Commissioner Brecky's point on maybe some of the whys as well.
Yeah, I think we can certainly connect with public health and look at the families they're serving and follow along, and then take a look at consequence years if we're seeing struggles in attendance at school.
Mr. Chair,
Go ahead.
can I have a follow-up? I think that's great, and family home visiting, especially those programs where we've started a long time relationship with families, it just might be another place to jump back in. Commissioner Beer, just want to bring up one thing you said about, and just been looking at and researching some other programs around the country too, and this voluntary, involuntary nature. I just want to build on what you said. Well, they have to agree, be willing. But I think we've learned that we have to continue to offer until it gets so bad that they have to go to truancy and go to court. We need to offer, because even in my own life, like I'm like, I don't need that, I don't need that, I don't need to exercise. Eventually I finally exercise, you know, and I hope we're thinking about that with programs, because I think sometimes this involuntary, voluntary, people say no. I don't think we should take the no as forever and amen. So I hope as we work on prevention that that's really built in, because I think that's more and more important for all of our prevention programs, that we're like, okay, fine, you don't have to, but we're gonna contact you again. So I just hope that's built in. I'd like to hear more about that in the future.
I have a comment I'd like to make, and some of it relates to things Amy said. You said that you share ideas and so forth, and also that I gathered that a lot of the work we're talking about here is kind of after the schools have exhausted every effort to work on this situation. And so I gathered that, and but what I want to say is related to what we have SCALE, Scott County Association for Leadership and Efficiency. And one of the strong values there, maybe one of the overriding, there's like 7 values, but collaboration is a key concept that we hope is at every level of government or schools or whatever, in the county. So I'm wondering if you see that a school district, you said every school, they seem to do things differently in all these different schools. When you say different, then I'm thinking, maybe wrongly, someone's doing it better. If they're all different, there's gotta be one that's better. I mean, maybe not, but I guess I'm wondering, do you have a way that you can see, get ideas from the other school districts in our county, or even best practices in the country, where you say, hey, this is, maybe we should be moving to this kind of model or this kind of effort within our schools, sort of collaboration, whether it's truancy or reading scores or math scores or whatever the challenge the school is facing. I'm talking about collaboration and sharing ideas. Do you have anything you want to say?
Yeah, absolutely. I think, yes, somebody, most likely one district's doing it better than the other in other states or what it might be, but I think it also comes down to the follow-through. I could say Belle Plaine, we're doing this, this, and this, but really we're only doing 2 of those 5 things really well. So I think saying you're gonna do it and then the follow-through is huge. And then the time and energy behind that is, so I would like to pat ourselves on the back. This past year, we implemented some new rules, and it was a lot of work, but we saw it through the whole year. And it really, really, although it was a lot of legwork and a lot of emails and reaching out and all that kind of stuff, our administration and our superintendent, we have a great team. We have a really, really good team that values this work or this specific topic as well, and that's huge. So it can't be a one-man show, because it will never go through. So we had at least 4 key players that we follow through on different levels, different outreaches, different meeting, intense meetings or kind of laid-back meetings or collaboration or reaching out, whatever it might be. So I think the follow-through and saying you're gonna commit to it is really big. And I would like to, I always have an attendance goal every single year as part of my job. And I think I just have it now for next year, is collaborating with the rest of the Scott County schools and figure out what they're doing and what we can do. And we've taken ideas from Chaska and, different cities, that might not work in our small town, or it might work. It kind of also depends on the families and the city, to be honest, whether it's gonna be, received well or not. And sometimes you figure out, wait, we're gonna do it either way, whether we think it's gonna be received well or not, and then in hindsight, you're like, ooh, okay, I'm gonna tweak that a little bit, we're gonna do things a little bit differently. So just being willing to make those changes, even though it's been going one way forever, change is okay, and kind of switching things up and seeing if there's, improvements can be had. I don't know if I answered your question, but. Or
I
statement.
don't need an answer. I'm just
Okay.
hoping, I'm an encouraging of the collaboration. That's my goal.
Yep, absolutely.
There is one other thing I would like to say. I think we all, as we went through school, could say we had teachers that were teaching a subject or teachers that were teaching me. They were encouraging me, they were spurring me on, they were helping me. It wasn't just teaching a subject. And so they had sort of a larger vision, I think, of how they could be engaged with students, And so I'm hoping that maybe that larger vision of deeper involvement, how are you doing? I see that you were absent. We missed you. Is there anything we can help with? Or, some kind of engagement right at the level of the teacher, moment by moment,
Yep.
A greater
Very.
vision for that, maybe.
Very important.
Okay.
Yeah, absolutely. Relationships is everything.
Yeah.
Yeah.
All right. Well, any more from anybody? Anything anybody wants to add or say? All right, well, thank you. Thank you, it was very good. We're on to item 7.1, which is to receive information on the Scott County Mental Health Local Advisory Council priorities. Maybe we'll pause here. Should we take a 5-minute pause here? We'll take 5 minutes. We're going to take a 5-minute break. We're going to reconvene the county board. So we're on 7.1, which is to receive information on the Scott County Mental Health Local Advisory Council priorities. Mr. Urba.
Chair Ulrich, County Commissioners, Administrator Vermillion. My name is Lloyd Urba. I am a member of the Mental Health Local Advisory Council and this year serve as chair. We have several members of our group. Would you please all stand? Dr. Ward, you know. Kayla Franklin is our vice chair. She's also a first-time member and right off the bat wanted to vice chair. She's one brave person. And then Dale Lomer is our former chair. Thank you both. Many of us have mental health issues or live with family members, friends, or relatives who have them. We are fully engaged in learning about and defining the most serious issues facing children and adults. We are here to present our 2026 report for your consideration. With ARPA and other funds, Scott County has taken bold steps. Hope's Portage is helping people with long-term homeless issues. Alina Health has opened their mental health and addiction center at the Integrated Health Center here in Shakopee. And Canvas Health and Open Door are offering a variety of services important to individuals with mental health and other needs in the same location. And around the corner is the Family Resource Center, building community and providing support to residents. This year, we took a different approach to how we would choose the issues to include in this report. Mental health issues have been around for a long time. We all experienced COVID and the challenges of that disease. You responded with bold steps that prioritized the necessary steps to address that health crisis. When our mental health team met for the first time in January, we wanted to try a new approach to defining the needs of our community. We made a list of organizations and people we wanted to hear from. Mia Casa, an embedded social worker with a coordinated response team, cultural liaisons, the Mental Health Center, and Southern Valley Alliance. We gathered data from our public health team, NAMI, and other psychological and mental health organizations. At our next meeting, there were presentations, lots of questions, discussions, and suggestions. Then we prepared a list of issues for our voting members to consider and prioritize. Following the vote, Dr. Ward wrote a draft report for their review. It was so well written that our members approved it with few changes. But what is different about this process? When you attend our meetings, you will notice that several people are willing to speak up and share their views. Then we have individuals who, because of their mental health or personal reasons, very rarely speak or share what they are thinking. We also had new members who joined our committee. How could we possibly tap into their views about mental health? We used the voting process so that each member could take time on their own to consider the issues and prioritize what was the most important to them. We also suggested that anyone to share their personal perspectives on any issue to send those in. What we discovered was that some of the most bold and interesting suggestions were from people who were new or had not shared their views during our meetings. So in addition to our report, you also will have personal comments and concerns from some of our members. Please read them when you have a few moments of quiet. This report has many issues to consider and some suggestions about how to better deal with the emotional and psychological strain, fear, and concern in our communities. We know that social media and smartphones are at best a distraction for kids. At worst, excessive use can harm mental health. Today's kids are exposed to the world's darkest content at far younger ages than previous generations. In 2022, Scott County youth reported greater struggles with mental health, such as depression and anxiety, than at any time in the history of the student survey. The rollout of many new AI features in social media may make those issues even more destructive. Drugs are commonly used by young people. The drug industry is introducing ever more complex and dangerous drugs. Social media and apps glorify usage to advertise and sell drugs. 1 in 4 adults who participated in the 2024 Community Health Survey said that they experienced 10 or more days of poor mental health in the past 30 days. Adults of color, including Hispanic, Latino adults, are more likely to have poor mental health compared to white adults. Mental health professionals emphasize that hypervigilance and fear of state violence are now common among immigrant communities nationwide. Family separation and the constant fear of it can lead to toxic stress, negatively affecting brain development and long-term health. One of our suggestions is to dramatically increase Scott County's media presence with information about how to take advantage of all the existing and new mental health and social emotional services. Allina Health, Open Door, and Canvas are doing their best to promote their services in new location. We need to highlight their programs as well as the services being offered by our amazing Scott County employees. We also need to encourage more media presence and old-fashioned information from the service, nonprofit, and community-based programs that we partner and help fund. Can we encourage every resident of Scott County to have an emergency plan in place that prepares them for the day a mental crisis hits? Can we encourage every school child to be ready to step in and help their friends when they are in emotional crisis? You heard earlier from Amy Hohenstein, the student support specialist in the Belle Plaine schools. She prepares media posts, puts up posters throughout their school, and has specific suggestions about how to get help when it is needed. They are a model for what we need to do. She also says, in a crisis, we forget everything we ever knew. That is why friends and neighbors need to be ready to step in and help. Another suggestion is more of a cultural shift. In my profession and community life, I focus on helping women and diverse individuals become more successful. In 2012, I worked with Brad Tabgate to establish the Shakopee Diversity Alliance. As a white male, I talk to women and diverse individuals to know what they are feeling and how they view the world. As a result of Metro's surge starting in December of 2025, I have been listening and learning. When 400 people were arrested on December 14th and the number of ICE agents grew quickly, our community faced a new challenge. Our non-white residents have faced and are still facing social media and political attacks unexpected in our country. Are we meeting our goals for Scott County? Residents are connected to their community, safe within their homes, and confident their needs will be met. Or, we will work with individuals and families to affirm strengths, develop skills, restore hope, and promote self-reliance. Some non-white residents are afraid, feeling excluded, and confused about their role in our communities. They want to be heard, have their concerns addressed, and know what their future will be. Please consider ways to invite their participation, get to know more about their cultures, fears, and concerns. They are looking to you for information, support, and stability. Thank you. I would be happy to respond to your questions or concerns.
Well, thank you, Lynn. This is an informational item and no action, but any comments or questions?
I just want to thank the Mental Health Local Advisory Committee for being here today and presenting. It's a great opportunity. I like being the liaison on that group. It's a great opportunity to hear perspectives from all the different members of the community. Last meeting, we had 2 Shakopee High School students that were in attendance, and I think that they're planning on coming back. So it's great to hear that younger voice also. So I want to thank everybody for joining in on the committee. I know that there is conversations about the new elections coming up and making sure that our potential elected officials are aware of the things that are going on in Scott County. So appreciate all the work. Thank you.
Yeah, everybody else would say thank you as well.
Sure. Kayla, would you be willing to hand out the individual comments? We have 2 versions. Dr. Ward is very creative in how she puts together materials. So we have a straight list of simply comments, and then she reworked all of them to fit them into the formal program that we presented. So you can read both or either. Thank you very much for your time.
Thank you. Okay, we're on to item 8.1, which is adopt resolution number 2026-128, affirming adoption and implementation of the standard measures program developed by the Council on Local Results and Innovation and agreeing to report results to residents. That's a mouthful.
Thank you, Mr. Chair. I'm Katie Malika from Quality Improvement. Thank you for the time today. It's hard to believe that it's already been a year since we've had this conversation on the annual performance report. Just to kind of give a very brief history, this is a basic performance measurement system that the county voluntarily engages with through the Office of the State Auditor's Office. In response to completing this report and reporting on at least 10 of the standard performance measures, we do receive some funding from the state. As part of this process, we do have to adopt a resolution declaring our continued participation, and then we do have to make those results public. For us, we actually put them on our website. Regarding the funding, we do receive 14 cents per capita. And last year in 2025, we received just over $22,000. And we've used these funds to support our resident report and our resident survey historically. And on your desk, you all received a physical copy of the 2025 annual performance report. There is also a copy attached to the request for board action today. And I would just like to take a moment to thank everyone across the organization. Mr. Chair, earlier you talked about the value of collaboration. And while there's a small number of people who put the report together, it would not be possible without all of the excellent work from all of our employees across the organization and so many people that also take the time to do data entry and collection. It truly speaks to the county's focus and value system of using data to inform our work. So I just want to thank everybody for doing that. This report would not be possible without that dedication. It is not easy. The full report does have 135 charts in it, along with additional information. I know you're all disappointed. I will not go through every single chart today. I know. Leslie here is disappointed. I knew it was a fine balance today of how many everyone here would like to see versus in the report. But the full report itself too is 174 pages, so please, at your leisure, I hope this is something you can use and reference. It is really such an honor to get to kind of record the history of Scott County. Other counties also participate in this process, and all the reports look a little bit different. And I will say that ours is different in that we also focus on having a little bit of an update on the strategic plan in it as well. So with that, just a very 10,000-foot overview of what some of the data is telling us. 2025 continued to be a year of notable successes. We continue to invest in our prevention and early intervention, and I think that we see that in our data. We also continue to see some declines in serious crimes and some of our deep-end child welfare services. We do continue to see, though, that there are needs for mental health in our community and that services are being utilized in that regards. The data also tells us that we really do have a high operational efficiency, whether it's in land records, taxation or property assessments, really across the organization. We're hitting many of our measures and being leaders in the state. Just to give us a base background too on work that impacts us. So the Met Council has their preliminary estimation of 161,000 people, or just over 161,000 people in 2025. And they have our housing units and households, which are both just slightly up from 2024. And then our household size averaged about the same. So we are continuing to grow, maybe not as fast as we historically have. But other factors that are impacting our population is we do continue to see that our people over the age of 65 continue to grow. We have 12.7% in 2024. Now, some of this is census data, so the most recent data is going to be from 2024. We don't have that 2025 data quite yet. But in 2024, 12.7% of our population is over 65, while in 2010, it was just 7.2. So this is obviously something that's important for the county to consider and can impact what services we'll need to offer and different ways to structure our community design. We also continue to see that our population continues to diversify as well. We continue to see a trend that our population is urbanizing as well. Our most recent data for the percentage that lived in the township is from 2020 with 12%, and then that's projected to go down to 9% in 2050. Another thing I wanted to note too was our share of households that pay 30% or more of their income for housing. Now, we did rise slightly over 2023, but I would just like to point out that it has remained relatively flat and is down from 2011, which was 31.8. And I think part of this, we can see the influence of the county's value in our housing continuum and continuing to keep an eye on having affordable, appropriate housing for everyone in our community. Our next slide is going to talk about resources available to our population. You'll see that Scott County does continue to remain higher than the Minneapolis-St. Paul metro area for our median household income. We did go very slightly down to $119,000 per year in 2024 compared to 2023, and that we did see a slight increase in our unemployment rate, but again, we do remain below the statewide average of 3.9. Next, when thinking about which of the 135 charts to show you all, I decided to kind of use our results map and kind of organize some of them by our goals of safe, healthy, and livable communities. So our first up is just talking about safe. So our safety metrics really are encouraging. This downward trend, I think, reflects our prevention strategies that we are designing to try to keep people out of our deep end services and out of that deeper end justice system. So if we look here, our serious crime offenses per 100,000 residents has continued to decline. Now compared to, so it's 2,030 people per 100,000, this is down from 3,800 in just 2021, which is a 47% decrease. Now it would be nice to show you a little bit longer data, but the BCA redid how they did some of their data calculation in the 2020-2021 period, so we're unable to compare those accurately. But I think this will continue to be something that is extremely interesting to see, and it's encouraging to see this number continue to decrease. And that state of Minnesota total should be released later this year when the BCA releases their crime report. Next up is partly Ron's area. We continue to see our criminal case filings. They've remained relatively flat over the last 4 years, which is also encouraging to see that we don't have more felony or gross misdemeanor offenses. And then we also see our annual jail average daily population. What is of interest to me, I think, is if you look at 2025, the total average was 86. This is the lowest number on our chart back to 2009, except for 2020, which was 84. And that's interesting because at that point in time, there's a lot of efforts to try to keep people out of the jail for offenses due to COVID going on. So to come close to that number, I think, is a really interesting data point for us to continue to review.
Excuse me, Katie, is this, Mr. Chair, is this Scott County annual, this does not include Borders, correct?
This does include Borders.
Oh, it does include Borders
Yes.
also, thank you.
Yes. Now, I don't remember the specific number of Borders, but I did look into that as well. That number has remained relatively flat. We took in maybe a little bit less last year, but that is part of that number. Which is nice because the jail has been able to manage that, so they haven't needed to open an additional jail pod.
Can I ask, Mr. Chairman, so that real number in 2020 would be between 110 and 120 if it wasn't for the COVID? Is that, could you make that assumption?
I cannot definitively say, but I would say yes, that number is artificially low due to measures that were taken to try to keep people safer and to keep them out of the jail due to COVID. That's why I thought this year's number was so interesting, because we continue to see that decline.
Just out of curiosity, I'd like to know at some point in the future, we have to obviously staff to a certain level in the jail just to be in operation. I'm wondering how many, with our basic staffing, how many people can we really house? What number would we be at if we were full based on our staff complement?
Yeah, we can bring that forward. I think when we had some of the jail discussions, the sheriff, I think, made a really wise decision in building out a small kitchen in one area, the shoe, I think, when they took us on that tour. But we can certainly have them come back and update on what we could house with our current staffing.
Okay, thank you.
Yeah, thank you for the questions. We also have some information about our juvenile and adult felony recidivism rates. Always as a note, this is just felony level offenses. It does not include your misdemeanor or gross misdemeanor. And then a 2025 data would mean that that would be a 2021 discharge. Moving on to outcomes regarding healthy. So I think part of what we're seeing too is that we have our shifting demographics that we always have to pay attention to. We also see some higher acuity cases when it comes to mental health and some of the challenges with contending with those. We see people continuing to use the jail mental health assessments, and then also coordinated response continues to be an area where we're able to really get people connected with mental health resources. And that area sees a high percentage of people that are referred to them that are accepting or receive referrals and resources at about 80%. So the left chart talks about our pre-petition screenings. This represents some of our deepest level of involvement with individuals. And in 2025, we continued to trend upward with this number. And while our total number is higher, the percent of repeat screenings has remained relatively flat. It's maybe gone down by about 1% there. And then we do see that our mental health center continues to serve additional people with their highest year yet of just over 5,000 individuals. Of course, MnChoices is a large area where many of you have advocated on a state level. And I just wanted to highlight, this is one of those cases where data that maybe isn't hitting the mark can also be a clear indicator of strengths in the organization as well. So you'll look and you'll see that the percent of on-time assessments did decrease slightly by about 1% to 20.3. But if you look down at the bottom for the completed assessments, it went from 490 last year to 821. That is almost a 68% increase in assessments. And the thing with MnChoices, as you all know, but saying it for the people at home maybe, is that once someone is in, that means they also have reassessments. And so that number at 821 would be unlikely to decrease anytime soon. So I just want to highlight that that area has continued to do well with a challenging topic, and this continues to be something that you all do a wonderful job of advocating for changes on a statewide basis, while also maintaining high levels of care for our residents.
You know, that would be another thing to, in the future here, kind of why. I mean, if you look historically, that's almost double. It's certainly double, at least if you average over the years, probably more than double. So the question is, why? Why did it jump so much? So I know you probably can't answer that today, but it would be interesting to know why.
Yeah, I can follow up on that, Mr. Chair, if there's any thoughts.
Yeah, and that's primarily older people, older adults, and disabled folks, but yeah,
Okay, well,
why do we have so many
If the
more?
why is aging
Yeah.
society, great. Okay, here's the background. I mean, you know, obviously, we've seen things happen in the state level where a program all of a sudden doubled or went 10 times the amount, and I don't know, nobody asked why. I don't think they asked why. So I'm just curious why, you know.
Absolutely.
No, it's a good question. I
Yeah.
think we should look at it.
I think Barb could probably answer that.
Let me
Okay.
phone a friend.
Yeah.
Mr. Chair, Commissioners, so part of this, if you were to go all the way back to 2013, is part of the Affordable Care Act, and there was this expanded eligibility at that time, and so the number of individuals, single adults that were eligible has increased. But there's a slide that's not in this deck that Commissioner Weckman-Brecky was speaking to, and that looks at the cost per individual. And the costs that are related are different than the number of people, and we could bring that back as a follow-up. But it's the number of our elderly and our disabled population and how much is being spent per participant. And that might also be interesting as a follow-up to this.
Okay, thank you.
So Barb, if I remember right, we did have an increase in aging. That is one of the issues.
Yep.
But also the disability qualifications, right? And what that meant?
Yeah, yes, the number of people that have had a qualifying disabling condition has also increased over time as well.
Okay.
Just since you're here, Barb, I think it'd be interesting, because I don't know the answer to this. Has the criteria for what's a disability qualifying condition changed in the recent 1 or 2 years, or not?
I don't believe within the recent 1 or 2 years, we could double check that fact. But the number of individuals that have qualified has definitely increased. And we have seen that with our elderly and aging population. We've also seen that with our youth that have been, and I think individuals and agencies out there that are working with individuals that have profound disabilities have been making referrals to county services at a rate and a pace that we hadn't seen previously.
Thank you, Barb. The right snapshot I actually included for Commissioner Wackman-Brecky, because I know this is something that is always surprising to see how many people are healthcare participants are on MA. And we do see that it spiked in 2022, remained relatively flat in 23, and has come down the last 2 years, but is still higher by quite a bit than the 2019 levels. So just something that seems like a good reference point for us to refer to. Of course, our child maltreatment rates continue to trend in a positive direction. We do see our reports, assessments, investigations, and out-of-home placements all trending down really since 2018. I think part of this is the total approach and that culture of safety and prevention, and just the organization in not just one way, but many ways, trying to work to prevent those deeper end services. The Scott Delivers from today is just one of those examples, I think, at trying to impact this whole body of work. So while this year's rate of maltreatment per 1,000 wasn't lower than last year, it was very much in line and continues a positive trend in that it's going lower. And then we also continue to see that the child protection timeliness remains high and is consistently above the state standards as well. And then, of course, I'd be remiss if I didn't include the chart showing the children in out-of-home placement in some of our deepest end services, and that while also not lower than 2024, still remains low overall, and much lower than the most recent peak in 2018 with 176.
Mr. Chair?
Yeah, go ahead.
Like, do we have, like, if you back up, you know how we have the state, the whatever color that is, goldish, do we have, now go to 20, the next slide, do we, well, okay, stay right there. On 19, on the left, this is always the question we're always asking, like, is there a correlation between what we're doing with that tapestry that we're doing here with diversion and prevention, and other things that are happening in the state? And now this sort of shows it's in parity of sorts, maybe going down at a faster clip, maybe. But I would really love to know what that delta is, like what's going, I shouldn't say the delta, but it's trending very similar to the state. Like, what is happening? This goes back to our FRC comments. Like, we tend to believe that we're doing those things, and I want to believe, but something's happening statewide, and they're not all doing FRCs and other prevention type stuff. So what's happening?
What's interesting too is always what factors are coming up that we.
Yeah, you got a willing participant, but yeah, go ahead.
What kind of things are we offsetting before they even get worse by our prevention work?
Yeah,
like
yeah,
some
yeah.
of that numbers
Yes.
we might never see because we've been able to prevent it from
Yep.
happening. And please come up, Suzanne.
Good morning, Mr. Chair, Commissioners. I think it's an excellent question. When you say not all counties have FRCs, I think over the past 5 years, Scott County started in August of 21. I think we now have 44 counties who are in various stages. Some have operational, some are launching. So I don't want to just target FRCs. I think it is that prevention. I think in 2018, Family First was signed into federal law. And I think that's the first time it marked an intentional conversation of prevention focused at the intersection of child welfare. So, like, I can't prove this. I suspect that has just produced prevention conversations statewide and nationally in a way that didn't exist before.
would it be, when I look at this, and I think that's a good question, and I think, and yes, not everybody's doing FRCs, but that's what I was kind of wondering. I think what you're saying is since 2020, everybody's been working on some type of prevention in the state. The conversation has changed. Whatever menu we chose might look different than somebody else. We might be further ahead on some things behind, but you're saying this state number going down is the impact of that kind of change.
A broader prevention
Right.
work that's focused within the child welfare system, yes. So for us, we looked at FRC, we looked at school programs. Other counties are doing different prevention activities. Some might be for FRCs, it might be something different, but I think there's just increased conversation about outcomes are better if we can actually keep kids out of the system up front and upstream. And so, like, what are different strategies to do that?
Thanks.
Mr. Chair, and yeah, and it just seems to me, in my mind, FRC is kind of that poster child, so it's not specific to that, but it is kind of one of our bigger things, or soon to be bigger thing, that it's like, okay, like, I want to believe, I do believe, I'd really like to know I believe, why I believe, is the point of that. And then on 20, the next page or next slide, we're missing kind of this state or, some known barometer, because I know it's just that, it's not gospel truth, it's just a barometer of being able to measure sort of against some other, common denominator of sorts. So something, a known commodity that we continuously measure against, again, just as a barometer, not that they hold the keys of the kingdom or gospel truth over it, but it's a signal point.
Yeah, I don't have 2025 data from 2024. I can say, Scott, we tend to jockey for position of the lowest rate of foster care per 1,000 with some other Metro colleagues. We were the lowest, again, from a rate of entry into foster care. I think, but your point from an overall out-of-home placement, similar to the previous slide around maltreatment, there is a general decline. Now, the pace, I would say that may look different for us as compared to other counties, but there is a general trend down.
Well, and it's, again, it's, we have to measure things, and, not everything that really, like said, counts can be measured well, but it's just a bar. Like, and at least in my mind, I'm really careful to say, you got a dashboard, there's certain things I look for certain things, but generally I get a picture of my dashboard, right? Get an idea. And so that's all I'm looking for is to have a semi-standardized bar that we are weighing against. Again, not that it's the end-all be-all, but it's common through the different things that we're trying to track. So it's just at least helps me contextually. Knowing that there's variability and there's nuance, totally get that. Not looking for the hard and fast, but I think it would just be helpful to be like, yeah, look at us, we're killing it, this is awesome, like, let's double down on this. Or, I'm not so sure, maybe let's not do that and double down over here. With obviously input and care, not just willy-nilly. That's all. Thank you.
Thank you. Yeah, like Suzanne said, amongst metro counties, we're one of the lowest, and that is something we could share with you if that would be of interest to see that compared to our colleagues. All right, moving on to livable. So we continue to see high utilization of our public community resources in our parks and trails. System-wide, a lot of parks did see actual decreased usage of their park visits, and Scott County was one of the few that actually saw an increase in 2025 of the park visitors. Let's see here. So this does not compare us to other systems, but it does show, and 2024 is the most recent data. This is something that we received from the Met Council later this summer. We'll get the 2025 data, but just showing that this has increased, and it's increased more than our population numbers has. So meaning just we don't have more people coming to the parks just because we have more people in Scott County. It's actually a higher percentage of people. Here's some library data just continuing to show high circulation amounts of both our physical and our digital library collection on the left. And then on the right-hand side, you continue to see utilization of the extended access. So you'll see in 2024 is where it was a partial year for all of those library branches to come online and have extended access. And we do have it in every branch except for Shakopee and our law library. But you really see those numbers increase drastically in 2025 for usage. So just showing people are able to have access to those resources in maybe an unconventional way for us a couple years ago.
Can I just say, I know that the Libby, the digital library that we have is really popular, but it also makes the wait time very long for getting materials. So I think that might have an effect, or I'm curious to know if that has an effect on the numbers that we're seeing in 2025.
Yeah, I don't know the answer offhand, but that is something I can ask our library folks about to see if they've noticed that, because you're right, anecdotally, I've experienced that myself. We also continue to see high on-time rates for our transit link, and then utilization of our household hazardous waste. Over 619 tons were diverted from the landfill. They also saw over 15,000 visitors to our HHW as well. And then, of course, I included some educational outcomes as well. This is an area of opportunity. While the county does remain slightly above state standards, it's still something we kind of see our high school on-time graduation rates kind of plateau out, slightly decrease from the previous school year. And then our third grade reading standards are also have decreased from 2024 to 2025, while the state remained kind of stable over the last 2 years. And behind the scenes, our internal services and public records teams continue to perform well. We've, of course, maintained our AAA bond rating. Our customer service desk is extremely busy. And despite increased transactions, they still maintain a 9-minute wait time, which I have some slides on this to show you. We also have an almost perfect rating in the compliance rate for the timely reporting of documents with our land records office. This helps ensure that the public has confidence that we're maintaining the documents they need, that gives them information about property. And then on our left is our customer service visits. This just goes to show they continue to have increased transactions, and the right side talks about our wait time. So of course, our driver's license, those are going to be by appointment. Those maintained a 3-minute wait time, and then for walk-in services, they continued to stay at 9 minutes for the last 3 years. And then something, of course, that is important to the board is stewardship. And we see here that the county levy as a percent of total personal income. So that's the total levy amount just divided by the personal income of the residents. And we continue to see that Scott County has risen slightly over 2023, and 2024 is our most recent data on this. This is one that's always lagging, but it does remain below the all communities percentage. But this is important because it's going to represent our total cost of government. And then while thinking about the strategic plan and just kind of giving you all some updates, so many of these things I can recall you being at the groundbreaking or speaking about or hearing about. So I didn't dedicate as much time to going through some of these because they're out there, they're being communicated. But it continued to be a year where so many things were done, and we've really seen a couple of big projects come online, especially when we look at our housing continuum. Hope's Portage opened and had the first families move in shortly after opening. We also had the Women's Transformation Home that was opened in October of 2025 and remains an opportunity for women who maybe have struggled with the criminal justice system to have housing. Coordinated response is now in all jurisdictions across Scott County, increasing that access to mental health resources. The Mental Health Center, of course, completed their very first full year as a certified community behavioral health clinic. And then, of course, the Integrated Health Center was completed and opened earlier this year, really providing coverage to a gap which we've had before with different services not available to clients, to residents.
If I could go back to the property tax, it would be interesting, and I don't know if this could be done, but when I was first elected to public office, and maybe city council or county board, but I used to think of the property tax as basically largely a third, a third, a third. The school district about a third, the county about a third, and city about a third. And I think that's changed quite a bit over time. It would be interesting to see the comparison rates of an average property tax bill, because I don't think the county has not increased, whereas I think maybe I think the other units of government maybe have increased faster than the county, but I'm just curious. It'd be interesting to see that at some point.
Yeah, Michael has that. We can get that summarized. It's different in different communities. I think you're gonna see a little different depending on the school district you're in, what city you're in. But we can certainly summarize that by all of the townships and the cities and show the different school districts. Michael does a really nice spreadsheet on that.
Okay.
And if I may let Administrator Vermillion, our Scott Delivers from earlier this year, a couple of their slides actually focused on doing that. So you could look at a comparable cost house across those different areas and see how your values might change or be different. And that would be available on the website right now for those watching that might be interested in that number too.
Okay.
Thank you for the question, Mr. Chair. All right, and so just a couple of other updates on the strategic plan. Of course, we have the work is progressing on the Highway 169 282 interchange in Jordan, currently in stage 3 with progress or completion date in 2027. You've all been out to the Miriam Junction Regional Trail late last year and have seen the work on that pedestrian bridge as well. Throughout all of 2025, lots of staff worked on preparing for the implementation of Workday, and that went live January 1st of 2026. And then the computer-aided dispatch project with Hennepin and Scott County has continued to advance. In the actual annual performance report, all of the strategic plans are outlined by the objective areas with additional details. I wanted to preserve time for a little bit of questions for you all too. So with this, I would respectfully request that the board adopt a resolution from this board declaring that they've adopted and implemented a system consistent with the Council on Local Results and Innovation. We've reported on the minimum number of standard measures identified by the council, which is 10. There's 20 in the report. And then with your approval, I will forward this to the Office of the State Auditor.
I just have one comment, Commissioners. I know our report is a little more robust than some, and I have always required it to come to the county board because I think it is the one place that we actually track some history for the county. And so that is why I've required it to come to the board in perpetuity when it has a resolution is part of our record when people want to go back and look at and research. And I think it's important that we present that every year and that you adopt it. I know there are some counties, when you're out talking to others, it's maybe 2 pages. But this is a pretty important record, I think, that we have that will always be part of the county board record. And one of the reasons we do a more thorough report and we bring it to the Board of Commissioners for a discussion and adoption.
Okay.
Can I just say that I appreciate the work that you did and that all the staff has done to put this report together. This is a good look at, or a good tool to use when we're looking at our comprehensive plan update, especially in like the area of demographics and the fact that we're an aging population, but we also have a decreasing birth rate. And we have townships that are decreasing and cities that are increasing. So I think it's a really good tool for us to use in making our decisions. So I really appreciate it. I do use this, and I already did use it and had questions. So thank you very much. So I make a motion to adopt resolution number 2026-128, affirming adoption and implementation of the standard measures program developed by the Council on Local Results and Innovation and agreeing to report results to residents.
Second.
Okay, we have a motion and a second. Any more discussion?
Just a brief, if I may, thank you, Mr. Chair. I mean, we need another report, like we need holes in the head. Like some of us were at AMC talking about different reports and, you know, when they're sent out, again, not necessarily here in this cute little adorable Scott County, that we do things so well, but other agencies doing reports and missing timelines, and maybe it's a draft, but it's kind of designated or hung out there as a real report. But I think it's important that we, and I think we do this, but just want to say, like, if there's reports that we're doing that, oh, okay, let's see, on the shelf or on the file, and we're not using it, like, we usually ditch those, don't we? Yeah. Yes, I knew the answer, I just wanted to ask that. If it's something that's just killing trees, which I don't mind if we're having a fire, but I don't need it this way, I don't think we do most of those things, because it's not useful in any way, and it takes a lot of time to do. But now, taking the time to compile something like this that is useful and actionable, knowing that there's always nuance and things to dig into, then it's worthwhile. So I think we have an eye for that, but we always need to ask ourselves the question, and I'm asking myself that question, basically, so, thank you.
All right. All those in favor say aye.
Aye.
Aye. Opposed? Motion carries. Thank you very much.
Thank you, Mr. Chair. Thank you, Commissioners.
All right, we're on to item 9, which is committee reports and commissioner updates. We're gonna do it different today. We're gonna start with Commissioner Beer.
Great, all right. 6/2, monthly administrator meeting. And then we all had the CDA joint meeting that afternoon, which was good. It was good to get together and kind of talk about their strategic plan and have some common language together and some being able to chit chat about common goals. 6/4 went to Lionel Lakes to visit the East Central Regional Juvenile Center. It was the advisory committee meeting up there. And I'll tell you forget the guy's name. I think his name is Mike. Where's Molly when you need her? Just, boy, talk about a round peg in a round hole, running this juvenile detention center. He's been there since, like, I think since it's opened in 95 or 96. Just doing some really hard work. And we use that. We send our juveniles that need that type of a facility. And that was the first time I'd visited. Very intriguing. And he's soon to retire, which I'm like, oh boy, this just seems like a real, you know, there's always people waiting in the wings. But yeah, it did feel like a loss. Like, and the change that he's seen in that area. But the heart, you know, he's given me a tour. I stayed for the tour. And you could see the kids, and sometimes they're there for a day, 2 days, some hours, you know, maybe a week or so. But the respect that he has gained by trying to, you know, bring them up to their level, but he would go down to their level to try to meet the needs of the folks. And he's the executive director up there, so that's going to be a bummer when he goes. So first trip was great. 6/9 board workshop. Later that, I guess maybe at noonish, we had lunch and a joint meeting with Carver, second of probably many, but we don't want to have meetings for meeting's sake. Really, the goal is, hey, what can we move out of here that we can work together on? What things can Scott County and Carver County work together on that we can not duplicate efforts? So some had said, let's find $500,000 or so many positions that we can work together on, and maybe the bar should be, I'm calling it the $1 million meeting. You know, what things can we come out of these joint meetings? We can have lunch with them anytime. It's not about lunch and reports and meetings, but what can we work together on? Because we're all getting squeezed by state, feds, other outside sources, but what can we come together on, like we did with our colleagues in Dakota, to find collaboration that we usually have these meetings, and I'll talk about AMC one yesterday. You know, we usually find ourselves nodding in agreement with our colleagues, amongst ourselves and our colleagues. Yeah. But then the action and doing lags. And I know it's always Herculean efforts, but it would be great to have real actionable items, even if they're just small little wins, to get us to something big. So great, hopeful, and looking forward to actionable items sooner rather than later. Then that evening, Prior Lake City had their city council meeting. 6:10 extension, 11 fish, 12, the morning of 12 was scale, And then 15 was at AMC District 10 meeting up in, I think it was up in International Falls, was it? Northern Anoka County. I'm like, hey, I'm almost to my cabin. I might as well just keep going. I didn't. But it was in their Anoka County Emergency Communications Building. Wow, what a facility. What a facility. And again, a great meeting, District 10 Metro folks. Again, a lot of head nodding. I mean, I mentioned to the group, like, it just feels like we're at one of these inflection points. Is certainly a state with a lot of things. Even the red team and the blue team, I think, can find some synergies. We're in the emergency services or communications building, so 911 is something we've been talking about. This is a great brand new facility, sparkling new. I feel like there's other ones. And talking with Leslie, I haven't been to the Dakota County one, but it sounds like that's a nice facility as well. And the things we're talking about is, can we not find ways to have regional 911 type facilities just to start, instead of everyone having their own facilities, their own buildings. They're dealing with the turnover, dealing with the mental health side of things. And there was a lot of agreement to do that, to do something like it. Again, a great meeting, lots of great ideas, lots of head nodding, blue and red and urban and rural and all of those things. But it always comes down to the big but. What are we going to do about it? What are we going to do next to actually make things actionable? Because I know this can be turfy. 911 can be a turfy area. But would it be possible to do some regionalizing that would give us redundancy? It would reduce denial of service attacks because you'd have multiple entry points, ingress, egress for those types of calls to be bounced. Mental health side of things, I mean, that's a tough job. Could we do something here in the metro by 1/1/29? I might even go 30, but if we have a date of doing things, like, that's enough time to get some stuff done. So we can talk more about that in the workshop in the round robin, which I plan on doing. But I love the head nodding. It just does feel like such a time as this. How do we make that actionable and actually do good work? Because the point I brought up is, like, I'm sitting in this room, couldn't help but think, and especially when I'm at AMC, the annual conference where it's more counties around the state, like, that's where the power is. Like, the power to change what is happening in the state really lies in the counties. If we can find consensus, and I did mention, like, I get it, the first one through the wall usually bloodies their face, but I'm willing, like, if there's others willing to do that. But what can we do to build that resistance back into the lap of St. Paul, so they realize when that red light or that green light goes off, what that means to the county and how that impacts things. And so sitting there, I couldn't help but think, are these the same things or similar things that a group of different faces 10 years ago sat around the table and talked about and opined about and pontificated on? And then I thought, well, in 10 years or 20 years, the faces around this room, are they going to be doing the same things that we're doing? Talking about, like, oh, we lament this and that. Okay, great. What are we going to do? Like, I said it's going to take courage. Do we have enough courage of the big counties, the little counties, the city counties, the rural counties to make some things happen?
Is that an assignment from District 10 back to the Metro County administrators, that by
No.
1/1/29, we work with the sheriffs?
I
mean,
make a
Mike asked
motion.
you guys, right, for direction and some things you want us to do. Do all 7 county boards? Chair Fernando sure pushed that discussion.
Yeah, I would love to see some actionable, whether we have to do a resolution or a motion or whatever, like, to do it. I mean, so much good stuff is happening. So much bad stuff is happening, but in the midst of that pressure, it just feels like we're at a point to where, we're starting to look more at the center and things that can get done to help our situations. Both if you're a Hennepin or a Ramsey or a cute little adorable Scott County, I'm not saying we have to be Hennepin County, but a lot of the pains and pressures we feel is the same thing. And so can we get out of the way of ourselves to actually do something actionable? I'm not doing this forever. I want to see some real sizable seismic shifts and changes before I go, and I think we all do. So you guys, you got some real short tenures to get moving.
We're wondering if food trucks are still here.
Oh, are they? Okay, I get it. So that ends my report. We can talk more in the round robin. MELSA's another one I want to talk about. I don't know if it's here. I won't talk about it here, but we can get rid of that by the end of this year. Boom. Next topic. Thank you.
If we give up the money we get from them.
All right,
Like, we still want the
Commissioner
money.
Brennan.
We want our portion of the money.
Round robin, round robin.
Round robin.
July 2nd was the joint workshop with the CDA to discuss their future strategic plan and how it fits into Scott County. June 2nd, I also attended the Shakopee City Council meeting. June 3rd was the Parks Advisory Commission, and we met with the Let's Go Fishing organization. They provide fishing excursions for seniors and people with disabilities in Scott County. And ironically, I had a picture of a family member going on Let's Go Fishing sent to me the next day.
Awesome.
So it's a great organization. June 5th was the Metro Workforce Boards met to talk about future planning. June 9th was the 27 budget meeting. June 9th was the joint meeting with Carver County. June 10th was our MICA meeting, and we had an update on the legislative session. June 11th, I had a meeting with Kate, and we talked about the upcoming meeting with the MPCA on solid waste. June 12th was Gail, and June 12th was my meeting with the county administrator. Yesterday was the AMC District 10 meeting, and we had talked about two topics that I thought were interesting. The MPCA resource report, I can't remember what the other word it was in there, and the effect that potentially has on counties, and also the greenhouse gas emission, and the effect that it has on our counties, and also the taxpayers, the amount of projects that were identified in one project. We have to have so many roundabouts, so many buses, so many, I'm gonna get Dave going on.
No. What was it, 469? Was that the number? Was that 469
Roundabouts.
roundabouts? 469 additional, this is in Washington County.
So I know that.
469
In one
roundabouts.
So I
Because
know-
of, yeah, it's crazy. Okay. I'm
So I
done.
know that AMC is, and the counties are working on that with the legislator. I think Representative Kraft was interested in having that conversation because I don't think he felt that the bill was really reflective, or the statute was really reflective of how that bill was meant to go. So, yeah. So that's all I
Thank
have.
you. Commissioner Wolf.
Thank you, Mr. Chair. On the second, the CDA meeting. On the third, MELSA had their financial audit. On the 8th, Planning and Zoning had a couple items on their agenda. 9th was the workshop with Carver, and then that evening Prior Lake met, talked about some of their plans for the future. On the 10th, the MESB, Metropolitan Emergency Service Board. Everything going pretty good there. That night, Cedar Lake Sewer met. We're gonna make a few policy changes there because the costs of doing the business there is kind of getting out of control a little bit. Not much, I mean, it's not bad. Then I-35 met. We talked about our reserve policy. Spring Lake Township met that night, as did Elko New Market. And then scale with the legislators on the 12th. That's my report.
Thank you. Commissioner Brecky.
Thank you, Mr. Chair. June 2nd through 5th, I was in Washington DC with Mary Kay Stevens. We were chosen to participate in an NACO Public Health Academy. I think I reported earlier that we were going to just spend that time really looking at pregnant women in Scott County who have substance use disorders and start brainstorming how we can better get them access to treatment, increase outcomes. So it was just a great opportunity to spend some time making some plans about next steps and how we can have better outcomes in that area. While I was there, though, I continued to do meetings. June 3rd, Law Library Board meeting, heard a report on Ally's activities over the last 2 months. She's meeting, hundreds of people every month. I think that Judge King was on that board meeting just talking about how much she's alleviating other pressures, whether it be on court administration or a county attorney's office, really helping citizens with their legal needs if she's able to. On June 3rd and 4th, in the evenings, I met with Senator Klobuchar's and Smith's staff, along with some other folks from Minnesota, really talking about the Farm Bill, because it's passed the House and still needs to pass the Senate. The one thing that I think, of course, we'd love to ask for all kinds of things, but one thing that we really, that we think might be feasible is asking for a delay, a 1 or 2 year delay in the SNAP benefit cost shift, which, as we saw in our budget meeting, is going to cost us $417,000 next year, and quite a bit more than that the year after. It's a big deal. It's a really big deal. The House said no. If that delay could get in the Senate bill, and then it goes back to conference committee, we can continue pushing on the House members about that. There's starting to be a little appetite for it. I think Julie Ring told us yesterday she's not optimistic, but it's really one of our last chances, and that 1 year delay would give, first of all, who knows what the world's going to look like in a year. Second, it gives some time for us to continue to work on that error rate, figure out what's going on, and not pay a portion of these federal benefits. So if we haven't already, I do wish or hope this board will maybe at the next meeting approve a letter to both senators on that, or do it by other means. Because as we heard with the talking, even though they're on board, the more information, the more that they can say every county has, and so many areas have asked for this, the further they can get on that. So that's really what I was working on in DC, to see if there's any possibility of that. And they will be, I think, in the next few weeks, marking that up and getting to those negotiations. Also spent some time talking more locally with those folks about our applications for the appropriations, really high interest in making sure the federal appropriations for the fire tower rehabs and at the RTF make it to the finish line. Really found some good support for that project, so hopefully it does. June 8th had Long-Term Services and Supports Advisory Council County Member Check-In, again from our wonderful budget projection meeting last week. We saw how we're having to budget in those cost shifts the next couple of years. And this coming Thursday, we'll have that full advisory council meeting. And what the county members are going to propose to the advisory council is that we issue our report early to the legislature and say we identified $600 million in savings, not just $186 million, and the legislature chose to incorporate, I can't remember, a couple $100 million of those savings, but allocated all those savings to the general fund and not to the work that the council was supposed to do, and really tell the legislature, you got to figure this out. We did what we said. We saved some money, really finding some efficiencies, but cutting some services to these folks. We did it. The legislature followed through and did it, but they just kept all those savings for the general fund. We saw how that will impact us in the next 2 years. So we'll see how that meeting goes on Thursday. Sorry, I talked about June 8th and now this coming Thursday, but trying to connect it to really what our budget's going to look like next year. June 8th, Leslie and I had our quarterly meeting with the mayor of Jordan, Jordan city administrator, and the county administrator, and Leslie. June 9th was our board workshop and joint board meeting with Carver County. I agree with everything my colleagues said about actionable items, but I think even just today in one of my meetings, I heard about an actionable item that's being looked at with Carver County on 24-hour crisis calls. So I do think, and that might be a good thing to have, because I think it's out there, but it might be a good thing for the boards to have, is what are the initiatives that are being worked on and where are they? And it just would be a good spreadsheet to keep, like once it's off the table, because we found out it didn't save money or it didn't work, it's off the table. So up here, we don't keep rehashing it. And then the ones that are in progress, and for a couple of people who really want to see that running total of, is it $1 million savings or $500,000 savings, that'll show it. So let's let's see if we can get that, because again, like I said, Barb just told me today, something they're looking at. So I think that's in process. And I want to say that I agree with Commissioner Beer about let's get to action, but I want to say that I feel like staff is there and they are taking action and doing these things. So we'll be able to follow that along.
Yeah, we brought that one up at the meeting last Tuesday, that was the one Barb added on there at the end, was to talk about
Right.
that.
So-
So what you're asking for is a tracking spreadsheet.
You know, kind of, and to include things that we talk about that then are gone. So like, I know sometimes I bring up the same thing and then I have to be like, oh yeah, we looked at that 2 years ago, and by combining that isn't a good idea. It just might be good to help us focus on where we're at on those things. June 9th had CAP agency board meeting, June 10th, MICA board meeting, June 10th also Scott County Extension Committee meeting. June 12th was the Scale General Membership meeting. Yesterday, AMC District 10 meeting. Yeah, I think there's more we can talk about there. I agree that there's appetite, and I think the conversation that Commissioner Beer and Leslie were just having about dispatch is probably a good way to start, to say what, it doesn't have to be all 7 counties. It could be whatever makes sense. And then this morning had my monthly meeting with Barb Dahl and Commissioner Brennan. Just one more addition. Last week, I spent 3 days in southern Minnesota at AMC district meetings, and just hearing those parts of the state and those boards talk about the issues, and most of them were the same as ours. The SNAP and MAFPA cost shifts, the long-term care services and supports, but also the thing that maybe is even hitting them more than us is just wage and benefit pressures on staffing. They're really seeing what we may have seen a couple years ago, and just a percentage of their levy going to that, and really having some struggles there on top of our struggles. So I think we say it a lot. We live in just a great place, and we're lucky to not have some of the challenges of counties much smaller than us or much bigger than us. That's the end of my report.
Thank you. On the 3rd, I had my monthly meeting with Leslie Vermillion. The 9th, our board workshop, and then the joint meeting with Carver Board after that. 12th was Scale, which was a legislative update. I was kind of surprised that one legislator was personally offended that we would express frustration that funding for 13 didn't come through. And I thought that was a little out of bounds, that he would get personally offended. Anyhow, that's just my commentary on that. 15th, Scale service delivery. They talked a lot about AI policy. Do you have an AI policy? And the policy that seems, at least in the initial phases, most prevalent was not putting personal information of anybody in an AI like ChatGPT or any of those AI tools, not putting personal information of anybody. And then Danny Lenz gave a update on the health insurance pool, the 2 paths to getting weighted voting. I agree to, the legislative path or the Commerce Department path, and I'm hoping today he will give that same mini update when he talks about the health spending accounts. I don't want to, I could say it now, but I don't want to mischaracterize it or get it wrong a little bit, but it did seem the conclusion, and I'm wanting him to give it, is that there's only one path moving forward, is a legislative change. And he can affirm or whatever that this afternoon. Fish Executive Committee, it looks like we're gonna try and seek 2 interns in 2 different categories, at least preliminarily. That's what we're thinking of, is one would be a marketing type intern, and one would be a tech type intern. So I've sent a email to somebody I know that's been a professor at St. Thomas in their business and marketing department to see if they can give us some leads on interns. But I think we're going to go for interns. And usually you get them for a semester, and you can have them zero in on sort of narrow projects or fairly narrow projects. So we're kind of excited about that. That's the end of my report. We're on to the county administrator update.
So, Mr. Chairman, just a couple things. Heads up, we are going to prepare comments for the solid waste report that came out. We talked about it extensively, I think, yesterday at the AMC meeting. We will bring those forward at the first meeting in July for approval. I think they're due that day, the 7th, if I remember right. So we will do our best to meet that, and if we can get them to the June 23rd as a draft, we'll also try to do that so we could have some discussion. We are preparing a white paper on MELSA, and to Commissioner Brecky's comment, it would be to maintain the funding. And one of the questions has always been, is there a statutory change needed? And there would not be. It's the library board shall appoint a qualified library director and other staff as necessary to establish the compensation of employees and remove them for any cause. So if MELSA were to appoint for 2 years, let's say the Scott County Library Director as that director, they could carry out making sure our contracts are together and we share information. So we believe there are ways to do it and to meet the MELSA requirements without having to have a full staff and running a building and their own programming. So that's what we're researching. And I think there is interest from at least 3 or 4 other counties to maybe take a look at it. And to your point, I think, Commissioner, if there were, let's say, the 3 southern counties were interested, you could maybe have your own even southern metro. So there are some things I think to look at that we could do that would put those monies into libraries and not overhead. And that's what we're trying to explore.
Just one question there. So not getting rid of a regional system, but having the regional system take a different look. Is that what you're saying? Okay.
Correct,
thank you.
Commissioner, because that still brings in the dollars, but then it goes into the library system and not the overhead, which I think is what we've been trying to talk about.
Managed levy, which is probably the most important.
Correct, right? And so if Hennepin was responsible for 2 years and Dakota for 2 years and Carver, I think the library directors could figure out, how to make that work and work together without having to have the bureaucracy of its own separate entity. That's what we're exploring and trying to put together. And I think Jake and Jen are really, really good at identifying those things. The next one was the greenhouse gas, and I thought that was an interesting discussion. I asked Adam and Brad today if we're commenting on the Metropolitan Council's work plan for the federal funding. And I think you have up until the middle of July to respond on that as well. But in talking with Joe, the roads that are struggling are the 13s, the 169s, the 10s, the 36s, right, that have to be converted because the Met Council never had any foresight that you might need a freeway beyond the 494 ring. So when you take a look at those roads, none of them are asking to add lanes, correct? We're using the 4 lanes that are there. We're trying to make them more efficient by removing signals and obstacles, putting in ped and bike crossings, as I passionately tried to talk about Friday morning, and then making them safer, because no matter what anybody says, congestion and safety go hand in hand. They just do. And so Joe's point was, and I think we need to think about this as we're talking about the legislation, the removal of interchanges from that point is a huge aspect that we need to get the 7 metro counties behind and outstate. I mean, the Stearns, the Olmsteds, the people on 14, they have that same issue. It's making our current infrastructure more efficient and safer. And so I think that's something we should talk about when you talk at AMC District 10, Commissioner, is maybe some specific wording like that. So I think there's some things we could help with there. And then the other thing, just to your point on salaries and wages, and it's what we tried to convey to a resident last year who said, well, it wasn't HR1 that caused it, it wasn't state shifts that caused it, it's your salary increases. And I suppose that's true, but when the revenues for salary increases don't keep up with the programs, that's where the disparity becomes bigger and bigger, and it shifts it to the levy, right? And so this is that whole discussion on capping, which the state has done, versus the federal government historically had allowed you to increase your salaries or those costs of doing business. And so that is, I think, a major point that Danny and Barb and I have been having as we talk about this budget and legislative things moving forward. It's that capped cost, the 2016 child protection cost that's never changed, versus HR 1 cap now some of these versus allowing us to be able to increase. And so that's where the salary discussion is. It's they're not keeping up those revenues. That's putting the pressure back on those levies. So that is one I think we really need to figure out how we talk about and what's the messaging around that. Because that revenue at 1%, you heard Kevin bring it up yesterday at Washington County, they're beginning to see it. Ling brought it up from Ramsey County. It's those same pressures. People are now seeing their revenues are not keeping up with the cost of the programs. That's all.
Thank you.
Mr. Chair, I just want to follow up with something Leslie said. I think I just was energized by, yes, Anoka County Engineer Joe and Commissioner Bigham and Commissioner Jepson yesterday, and the little bit of progress they've had on that greenhouse gas issue for us. So I feel like that they finally have gotten a little bit of door open for us to talk about it, and I agree that we should continue and hopefully get involved with that. And if Tony and Adam can a little bit to be involved with that group, I think we could be helpful.
Yeah, I think it probably needs to go to the Transportation Alliance Commissioner. I think you need the Commissioner of Transportation to be engaged, and highways are important. You know, you can talk about reducing VMT, you can talk, but actually increased VMT sometimes is a positive for growth in the economy and the development as well on these major highways. It was my point on the Woodbury mayor. She came out and said, I'm proud to be a suburb. I'm okay that we have cars and that we have roads. That is what our people want. And the Met Councils, you all have to fit into this little block, and we're gonna change to be downtown Minneapolis or downtown Shakopee. It's okay Shakopee has a downtown and that they have a suburban area, and that is all right. And how do we safely meet the needs of all of those communities? And they're different. And so I think having that discussion, I think Commissioner Ulrich having a discussion with Connie is helpful as well with his relationship there on how do we continue to have that discussion. So I think there's different ways we can tackle it.
All right. We're on to attorney-client.
Not necessary, Mr. Chair.
All right, thank you. We're going to adjourn here in a minute, but I'll say that after going down to the food trucks and supporting that event, we're going to have a conversation on health savings account and Scott Water Management Organization plan update. And I think we'll also have a round robin. Now, we're slated to leave here at 11:15 and start at noon for our workshop. Do you want to still start at noon, or do you want to start at 12:15?
Noon.
Start at noon?
Yep.
Okay, so we'll take a motion to adjourn.
Second.
We have a motion to second. All those in favor say aye. Aye, opposed. We're adjourned, and we'll reconvene at a workshop at noon.